malaria, we'll get you down to zero. We'll get you down, yeah, we're clapping together, chase you away, a simple dance and a simple cry, we'll go a long way. Listen, Corona, you won't fool us, we see the bigger picture, without you, sauce, we'll keep fighting malaria, yeah, even as you fight, I say, oh yeah, Corona, you won't fool us, we'll keep fighting malaria, even as you fight back, as you fight back. Hold it, somebody give me a clap. Hey, yeah. Malaria, it's time to go. It's time to go. Malaria, we'll get you down to zero. We'll get you down. Yeah, we're clapping together. Chase you away, a simple dance and a simple cry. We'll go a long way. Listen, Corona, you won't fool us. We see the bigger picture, without you, sauce, we'll keep fighting malaria, yeah. Even as you fight back, I say, oh yeah, Corona, you won't fool us, we'll keep fighting malaria, even as you fight back, as you fight back. Hold it, somebody give me a clap.
Good afternoon and welcome to World Malaria Day Virtual Media Roundtable. My name is Patrick Munasa. I am the Director for Malaria, Vector-Borne and Zoonotic Diseases at the National Department of Health. I'll be moderating the session for you this afternoon. World Malaria Day takes place on the 25th of April every year. It's an internationally recognized day, and it was instituted by the World Health Organization member states during the World Health Assembly in 2007. On World Malaria Day, we mark the successes in the fight against malaria, and we highlight the responsibility of countries and member states to the World Health Organization and the World Health Assembly in their fight against malaria to have a world free from malaria. Over the past 2 decades, we have made great progress in the malaria fight, saving more than 7 million lives and preventing over 1 billion cases. The fight against malaria is far from over. In 2019, the World Health Organization estimated that 229 million cases of malaria occurred worldwide and 409,000 deaths occurred. Therefore, it's important for us every year to highlight the plight and the suffering of millions of people around the world from malaria. This year's World Malaria theme is Zero Malaria. In other words, getting to no local transmission of malaria in any parts of our countries, in South Africa and on the Southern African continent. The objectives for World Malaria Day, as I said, is to highlight the successes of countries that are fighting malaria, to inspire a new group of countries that WHO is targeting for malaria elimination, and this also includes South Africa, and to demonstrate zero malaria is within our reach for all countries. It therefore gives me great privilege and pleasure to welcome our speakers for today. We have 6 esteemed speakers. The first speaker is Dr. Richard Kamwi. Dr. Kamwi is the ambassador for an Elimination 8 initiative. He's the former Minister for Health in Namibia. Second up, we have Dr. Owen Kaluwa. Dr. Owen Kalua is the WHO representative in South Africa. Then we have Professor Karen Barnes. Professor Karen Barnes is the chairperson of the South African Malaria Elimination Committee. And then our very own Minister for Health, Minister Zwelini Mkhize. And then we have Sherwin Charles, the CEO and the founder for Goodbye Malaria. I will please ask those who are participating and on this roundtable, for if you have questions, we will take them at the end of all of the presentations, which will be very brief from each of the panelists. Please, can you include your questions in the question box, and we'll make sure that we get them addressed towards the end of this, this roundtable discussion. So without any further ado, we will ask Dr. Richard Kamwi, Dr. Nchabi Kamwi, to take us through his presentation. Sir, the floor is all yours. Can we please get Dr. Richard Kamwi's microphone to be unmuted? We still can't hear you, Dr. Kamwi. Dr. Kamwi, we still don't get any audio from you. Dr. Kamwi, we're still not receiving you, sir. There seems to be a problem. Can you unmute, please? You need to rejoin audio, sir. Okay, so I think while we are waiting for Dr. Kamwi to get his audio fixed, maybe we move to the next speaker. The next speaker is Dr. Owen Kalua, who's the WHO representative for South Africa. Dr. Owen Kalua, Sir, you have the floor.
Thank you very much, Program Director. I want to have access to be able to share.
Okay, can the technical team please give Dr. Kalua access to share his slides, please?
Okay, let me see.
Dr. Kalua, you have access, yes, and we can see your screen. Thank you, sir. Go ahead. You can put it onto slideshow for us, please.
Okay. Let me do that quickly. Okay, thanks very much, Program Director, Honourable Minister, distinguished panelists. It's my pleasure to be able to give this presentation during this webinar. So my presentation is Getting to Zero, looking at the Global Technical Strategy for Malaria 2016 to 2030. So I'll be looking at the global burden very quickly, the Global Technical Strategy, the progress in malaria control globally and in the Africa region, and getting to zero. So first of all, let me just quickly give the recent history of malaria. That is, in the 90s, it was the foundation for the global response. And 2000 to 2015, it was the period of the MDG, where the scaling up and the impact of malaria was realized. And from 2015 to 2019, we had a plateauing, and 2020, COVID-19 comes with its challenges. And now we have to rethink learning and adapting so that we can catch up on malaria. So countries in the WHO Africa region are responsible for over 94% of the global malaria cases over the years. And when you look at these slides, this slide you clearly see the one in green representing the case, the situation in the Africa region. And the same is true for malaria deaths, where 94% of the global deaths in 2019 occurred in WHO Africa region, which in other words, sub-Saharan Africa. So we carry the back of the burden as the Africa region. And when you look at the global trends in malaria case incidence per thousand, you clearly see that from the 2000 to about 2015, there was a 9 to 10% decrease or reduction every year, every 5 years rather, until 2015, where there has been stagnation. And 29% reduction in global malaria case incidence occurred during 2000 to 2019. And there was less than 2% reduction in malaria case incidence between 2015 and 2019. So that is the period of plateauing, highlighting that the plateauing began even before COVID came to have its impact. So the global technical strategy is about getting zero in the global, getting zero as a global malaria vision. So it is a medium-term plan towards zero malaria, covering 2016 to 2030. And it's the WHO and the global malaria community vision for getting a world that is free for malaria. And this global technical strategy has 4 goals: reducing malaria mortality rate globally compared to 2015 as the baseline, and reducing malaria case incidence globally, eliminating malaria from countries in which malaria was transmitted in 2015, and prevent the establishment of malaria in all countries that are malaria free. And when you look at it, the targets are for 2030, but it has got interim milestones for 2020 and 2025, so that we check the progress as we go towards the end date of the global technical strategy. So what has been the progress? In terms of malaria case incidence, 31 countries are on target for the 2020, or have been on target for 2020 global technical strategy milestone. 21 countries have made progress since 2015, but are not on target, and 40 have either not made progress or have registered increases. So the progress we have made is rather mixed, but by and large, we have been below the target. And then when we look at, let me just come back on mortality. Again, we have got a mixed picture where there are countries that have made progress and those that have not made enough progress. So the map here indicates the details, and later on when the slides are shared, people can have a closer look at that. But again, in terms of malaria elimination, progress has been made. For example, for countries with fewer than 10,000 cases, for example, they have increased from 20, there are 26 countries at that time to 46 countries. And those that had fewer than 1,000 cases, those again, the number has increased. So progress has been made overall in terms of the elimination of malaria. What has been the situation with funding? Funding has also been increasing and then plateaued around from 2012 going onwards. And this is also an important issue because we need really to keep up the funding for malaria so that we can be able to meet the targets, but at the same time also use the limited resources that we have more efficiently. So this investment that has been made, in fact, has been one of the biggest, has produced one of the biggest returns in global health since the beginning of millennium, in that 1.5 billion cases of malaria have been averted and 7.6 million malaria deaths have been averted. But when we compare the global progress towards the milestones from 2015, we see, and then the projections that are made, we see that on the trajectory that we are on, we are likely to miss by far the targets where we are supposed to be by 2030. So the green line is where we are supposed to be. The blue and dotted line is indicating where we are. So this trajectory, which is indicating in terms of malaria cases, shows that we are bound to miss the targets by far. And the same in terms of when we look at malaria mortality. So what is important is also to note that this is without including the impact of COVID-19. So if you do that, it means we might be even more way off arriving at the targets. COVID-19, of course, has contributed very much and has affected our response towards malaria, and therefore has made even the gap even bigger. But the world has responded. There's been cross-partner effort led by WHO to tackle malaria and COVID-19, and a call in March was made by WHO to maintain core malaria control services, and that was last year, while protecting healthcare workers and communities. And some modeling has been done also to look at the impact of disruption in services. And this gives that example here, that if we have, for example, a 50% disruption in services, we would have more than 100,000 increase in malaria death. And then when you look at where we are now, if you look at the red point here, just to get the pointer on it, you'll find that if we have a 50% reduction, if you look at that red point, if you go backwards, you find that it will take us back to levels maybe that we had in 2012 in terms of malaria deaths. And this in itself will indicate a very big impact in terms of pulling us back from where we have achieved. So the effect of COVID has been great. But what have been the lessons? There's huge value in protecting people from infectious diseases as they have catastrophic health and economic impact, particularly for the poorest. So really it's important that we continue, in spite of COVID, to focus on other infectious diseases. Building health systems, so these health systems have been challenged and we need strengthening to address the existing public health priorities and new strength, and we need global solidarity. And so that we can extend protection to everyone. Leadership at all levels is also critical and needs to be adaptable, needs to be authentic and accountable, drawing upon science and learning lessons from that. And COVID-19 has demonstrated the valuable principle of subsidiarity and the importance of local data, local intelligence, and local decision making. But we need to go to zero. We need to catch up. So the why. Why do we have to rethink malaria in order to catch up? Because we are off track, because we have COVID, and also we have been off track even before COVID. And we have to do this by listening and learning from the front line, learning from lessons that have been observed from the high burden, high impact interventions and other interventions, learning from our experiences and engaging those responsible for strengthening the delivery system and addressing the determinants of health, and complemented this by a global process of review. And we need to begin to do more effectively and to do more equitably and deliver services for everyone, but not necessarily deliver everything, but deliver targeted services according to the need. And what is the current and necessary capacity to solve problems at country level? We should take cognizance of our capacities that we need. And then stakeholders in each country must come together and rethink malaria so that we can catch up and we can sustain the trends so that we can be on the path towards zero malaria and answer the question, what is working, what is not working, and what can be done differently to catch up and attain the 2030 targets. Adopt and implement strategies for reviewing momentum towards the 2030 malaria targets with shift to malaria as a social, economic, and developmental challenge, requiring comprehensive and all of society response and investment, looking at the various factors, the determinants of health, the determinants that affect the susceptible to infection by malaria and also to the impact of malaria. And the rethinking of malaria should also be taking place and is taking place at the global level and also at a regional level within Africa. And in countries, we have to do this. At regional level, we have to do this. Rethink malaria, use our experiences. So that should inform what we do as we move towards catching up what we have lost and that we are on the path towards zero malaria. So these are some of the expected outcomes from the dialogues that should take place. We shall not dwell much upon, but they are all quite critical to inform us of the way forward. Malaria is preventable, malaria is treatable. So we should put all our efforts to ensure that no one gets affected by malaria, no one falls sick from malaria, and that malaria does not affect all our efforts for socio-economic development, that we should maintain good health and well-being for all the people. I thank you for your attention.
Thank you very much, Dr. Kalua, for that very informative talk. In fact, all countries around the world that are working closely with the World Health Organization need to ensure alignment with the global technical strategy. So I think you very clearly laid out the goals for us, and obviously we will align our national strategic plans accordingly. Maybe it was fortuitous that you had to present first because you painted the global picture excellently. Just checking if Dr. Richard Kamwi from the Elimination 8 initiative. Sir, maybe we can take your presentation now if your microphone is fixed. Dr. Kamwi, the floor is yours, sir. Your microphone is muted again. Maybe if you can just unmute.
Unmute, I've done it?
Yeah, now I can hear you. Please go ahead. Welcome.
Okay. Thank you very much indeed, Moderator Dr. Monasa. My brother, Dr. Zwelini Mkhize, Minister of Health South Africa, distinguished panelists, ladies and gentlemen. First, I would like to extend my sincere apology for the mishap. I am at the farm where the network is extreme challenge. But here we are. Thank you to the distinguished panelists Cross-border collaboration is the key, is the key to eliminating malaria in Southern Africa. Next slide, please. Looking at these maps, one can deduce that, one, we as a region, that is SADC Elimination 8, have made significant progress in the reduction of malaria. The map is getting less red, as you can see, more blue. Secondly, if you hone in on the border areas up north there, you can realize that much work has been done in controlling malaria across borders. And thirdly, however, it should be said, if you look at the map in 2019, we still have the problem of malaria in this region. And much work still needs to be done to reach zero. Next slide, please. So where are we now? The slide here shows a snapshot of the most recent scorecard of the progress of the Elimination 8 member states. Although much work, as I said earlier, has been done by bodies such as the Elimination 8 in harmonizing policies across the border, and more needs to be done to translate the policies harmonized at the ministerial level to implementation at the technical level. Next slide, please. Next slide. What do we see on this one? Furthermore, one can appreciate from this map that the transmission across borders still poses a very big risk to fueling local malaria across the borders. If you look, on the borders. Further, emphasizing the point that we must work together to commission a joint response to malaria elimination across borders. No shortcut to that. Next slide, please. What do we see here? There are still many challenges we face in the fight against malaria in the Elimination 8. First challenge is the issue of inadequate resources. South Africa is a unique example. It's not eligible for external aid from bodies such as the Global Fund due to income classification. Other member states such as Botswana and Namibia are already transitioning out of Global Fund in the coming year or two. And the rest of the member states are still highly dependent on the investments of external donors. The issue of domestic resources becomes very critical in getting to zero. Additionally, allocation of funds based on regional impact becomes more important as the advancement of one country is highly dependent on the advancement of another. The second challenge is the issue of the disconnect between policy endorsements and technical implementation. We have instruments such as the E8 Ministerial Agreement and like the SADC Declaration that was signed by heads of state in 2018 to eliminate malaria across SADC by 2030. However, some of these policy declarations have not resulted in action at the local level. We need to ensure that what is declared at the highest political level translates to support for implementation at the local level. What is key is that each and every member of the population have adequate access to malaria services. Thirdly, the third challenge, we face persistent health systems, challenges across the E8 region that crutch the malaria response, especially in times of emergencies and epidemics. The COVID-19 pandemic has stretched our health systems, both in terms of capacity and other resources. Much work needs to be done to empower our health systems to have the adequate capacity to anticipate and contain epidemics of all nature. That way, we can truly get to zero malaria. Next slide, please. The E8 has developed a new strategic plan, which is currently in draft format, that seeks to respond to the question, how will the E8 respond to these persistent challenges of getting to zero in this new strategic plan? Three priorities. Coordination, the first. We must align all member states to the elimination mindset. We must bring in the relevant partners to support existing national plans. And we must engage at all levels, technical, strategy, and policy to ensure alignment to one vision and one mindset. And second, advocacy and resource mobilization, ensuring the health ministers of the E8 who are the vision bearers of this mandate and are led by my brother, Dr. Zwelini Mkhize, as the current chair, must serve as the ultimate champion for malaria elimination. Policies must be harmonized across borders, and additional resources must be committed in order to reach zero. And lastly, the third one, cross-border harmonization. By ensuring countries with connected borders are working with each other as a joint team to sustaining the gains made in each individual member states at the community level up to the ministerial level. We as member states must continue to hold hands together, and only together that we can do so much. Share resources, share data, and work with our border communities to institute one message, one vision, and one strategy. Next slide, please. What next? As the Secretariat, what we are contemplating are the following questions. How do we ensure high-level commitment to malaria elimination translates to action and resources? And the second question that we need to ask ourselves is, how do we empower communities at sub-national level to own the malaria elimination agenda? Finally, we need to interrogate a question. What challenges require unique, tailored solutions? Which challenges require a joint approach, such as regional response, as in the case of the E8? And finally, may I say, and together, that's the last one, the last slide. Yeah, before I can say thank you, I want to say, and together, we can eliminate malaria in South Africa, in the E8 member states, in SADC as a region, and indeed we can in the entire African continent. And why not the entire global space? It is possible only if we work together, collaborating, strengthening our border collaboration. Thank you very much indeed for your kind attention. Over to you, Pat.
Thank you very much, Minister Kamwi, for those very eloquent words. I must admit that South Africa is part of the Elimination 8 initiative. We subscribe to all the goals and the targets that you clearly articulated. But as you said, no country is an island. We are all surrounded by borders, and we need to work collectively to make sure that we can achieve the goal of elimination in South Africa and in the countries that surround us. So we now bring it back home. Professor Karen Barnes, she is the chairperson of the South African Malaria Elimination Committee, and she will drop the spotlight on what will it take for us in South Africa to get to zero malaria. Professor Karen Barnes, the floor is all yours.
Thank you so much, Dr. Manasa, and thank you to all for creating this opportunity to keep malaria high on the agenda, despite the many challenges that we face. Next slide, please. So we've had great introductions about the state of malaria in sub-Saharan Africa and the E8. And here I want to hone down on what's happened to malaria in South Africa in the last 2 decades. You will see here that we've made great progress in reducing the number of malaria cases since the year 2000. Key to that was the regional initiative of the LSDI, as well as the artemisinin combinations that were introduced in KwaZulu-Natal, the first place in Africa, and the reintroduction of DDT. And that made a dramatic impact in 1 year. And that trend continued for quite a while, although reaching the plateau that many other speakers have mentioned, until we faced a worryingly high outbreak of malaria in 2017, which was largely attributed to perfect malaria ecological conditions. In that year, we had Cyclone Dineo, there was flooding, there was a warm winter, and we were all showing up. The malaria programs that we had that should be resilient to changes in the climate were not good enough. And this was a problem across the region. Many of our countries ran out of malaria treatments. We were using second-line treatments because first-line treatments weren't available in our own countries, in our neighboring countries, and even in the manufacturers. To the great credit of the malaria programs in South Africa and in the region, since then, things have improved steadily. One of the key interventions, which Dr. Kamwi has highlighted the importance of, were the border mobile clinics that were set up that have had a significant impact on reducing malaria transmission in South Africa and beyond. And this has continued until 2020, when we saw a further reduction in the number of malaria cases. And this is striking. You will have heard from Dr. Kalua what a challenge the COVID pandemic placed on malaria. And many countries are seeing increases in malaria. But the suspicion that we have is that the border closures related to that pandemic might have resulted in less movement of mobile and migrant populations, and that might have contributed to the ongoing decrease in malaria that we're very pleased to have seen. Next slide, please. There are major challenges, and it is not an easy task to eliminate malaria, but all of us here are together believing that we can achieve this goal, but we need to identify and be honest about our challenges. We know that our mobile and migrant populations are clearly making a great contribution to our economy. However, the parasites that cross the borders with them make eliminating malaria slightly more challenging. More significantly, as people and healthcare communities and healthcare workers see less and less malaria, know fewer people that have suffered from or died from malaria, their behavior changes. They don't think about malaria, they don't get tested quickly, they don't get treated quickly. All of that compromises our attempts to eliminate malaria. And lastly, drug resistance and insecticide resistance are major challenges globally. Most worryingly, we've seen the artemisinin drug resistance that was well established for the last decade in Asia, spreading its way into Africa now. We've had confirmed artemisinin resistance in Rwanda, in parts of northern Uganda, possibly in Tanzania, and a few other reports. The artemisinins are the backbone of our treatment for severe malaria and uncomplicated malaria. And unless we detect this early, contain it, and manage our patients accordingly, morbidity and mortality can increase. Next slide, please. Given our short time together, I'm going to look at the 3 pillars of malaria elimination in program in South Africa, comment briefly on our main achievements, and give you my reflections, my personal reflections on what we need to do to reach zero malaria. In terms of indoor residual spraying, I think that this is the backbone of what South Africa has done since the 1930s, uninterrupted indoor residual spraying with high coverage. And this is what has made malaria elimination a feasible goal in South Africa. However, we need to maintain our core field teams. We need dedicated people in the field year on year to maintain these activities. And there are real challenges in terms of human resource policies and practices and delays that make maintaining the staff that do this core work more and more difficult. We need to strengthen it with reaching the larval stage of the mosquito vector, the baby stage, to tackle residual transmission. And we need to get better at surveillance of what is happening to our mosquito populations. We need indicators to tell us when we've got insecticide resistance. We need surveillance to tell us where we're having mosquitoes and where to target our control interventions. Next slide, please. In terms of case management, the next pillar, or what's called parasite control, we've got many achievements to be proud of. We were the first place in Africa to introduce the artemisinin-based combination treatments that were core to reducing malaria since 2000. We've reduced malaria deaths with the introduction of injectable artesunate, and we've piloted the role of primaquine, which is the only drug that we have that's available to prevent ongoing malaria transmission. However, we need to scale up primaquine use. This is made difficult because it's not yet a registered medicine in South Africa, and manufacturers aren't keen on the small South African market. More importantly, we need to scale up testing and treatment of malaria cases in the community. We can leave no one behind. We need to reach the unreachable, those mobile and migrant populations that often have asymptomatic malaria. They're often reluctant to seek treatment at health facilities, and yet they're the people that can contribute to ongoing malaria transmission. The countries in the world that have succeeded in eliminating malaria have almost invariably attributed that to their community health workers, people in the community who can not only do education about malaria, but can actually test for malaria and treat malaria cases. This is something hard for South Africa to achieve because currently our community health workers are limited to playing a different role, and testing and treating will really test how well we can adapt our systems to meet the needs of malaria elimination. As mentioned, drug resistance is a major threat that's reached Africa and will no doubt reach Southern Africa in the not too distant future. So we need to make sure our treatments remain effective. Next slide, please. The last pillar I want to reflect on is that of surveillance. Surveillance is the core intervention that informs absolutely everything that we do. South Africa was one of the first places to have malaria risk maps. The first one that I know of was in 1921. We're increasing case notifications of malaria within 24 hours. Timely notifications mean timely action and a better chance of malaria control. This is further supplemented with weekly updates to all stakeholders. We're also getting better integration of notifications of malaria with other notifiable medical conditions. This has come with a lot of teething problems, which many of us could have done without. But when this is working optimally, it is the ideal system to take us to elimination. We've also launched foci clearing programs. So if you're getting notifications in a specific area, you can respond immediately and prevent that transmission from increasing. To reach zero malaria, it's embarrassing to say that South Africa really needs to improve its connectivity to the internet for all our malaria stations and field teams. This has also been a major challenge. More importantly, we need to stratify our interventions depending on the intensity of malaria transmission. As you can see in this figure here, our weekly updates show us what's going on where malaria cases are increasing or decreasing. And then we can stratify interventions to make sure that we get the right solution to the right place at the right time. And lastly, while we're having all this great surveillance data, we need to make sure, Dr. Kamwi, Dr. Kalua, and my colleagues, that this data gets shared. So we get a warning. If there's an outbreak somewhere in South Africa, our neighbors should know about it as soon as we know about it, so we can all act together. Last slide, please. So in conclusion, I'm proud of the progress that South Africa has made, and our Honourable Minister, Zwelini Mkhize, has been a key component in the political advocacy in achieving a conditional grant, making sure that the amount of domestic funding needed to take us where we need to go has been available. However, we need to strengthen our implementation. From the national to the provincial level has happened, but that needs to then spread to district and sub-district levels. We also need to overcome systemic challenges, particularly in human resources and supply chain managers. Once we've got closer to malaria elimination, we need to plan for integration to ensure sustainability. And as all of us have said and will continue to say, cross-border collaboration is essential. Thank you very much.
Thank you very much, Professor Colin Barnes, for that excellent presentation. What comes out of the presentation, as you can see, is that malaria control and now elimination in South Africa is guided by science and by evidence. And the key interventions of case management, vector control, and surveillance are absolutely critical for us to move the elimination agenda in South Africa. There's some challenges that Professor Barnes has alluded to. The issue of getting drugs such as primaquine registered in the country, especially when there's the demand and in terms of the numbers are not so high to justify registration. That's the one issue. And the other issue is, how do we get internet connectivity to the deep rural parts where we need to get data back up to the central levels? So I think this is a very good segue, Professor Barnes, to throwing a challenge to our next speaker, who is none other than Sherwin Charles, who is the co-founder and the CEO of Goodbye Malaria. So Sherwin Charles, maybe if you can take us to your presentation and see how you can get some of these challenges that Professor Barnes has just alluded to, how we can get them addressed. Thank you, Sherwin Charles. The floor is all yours, sir.
Technical challenges, apologies. But thank you very much, Dr. Manasa. I think from my side, it's not a presentation, but really to speak to what does the private sector add and what does the private sector bring to ensure malaria elimination becomes a reality. we all aware that global health and public health issues can have a huge impact on our economies. If this was a difficult discussion 2 years ago, today it's a reality. And we've seen how addressing the pandemic has affected business, has affected incomes, and has created increased unemployment and increased poverty. Eliminating malaria is one of the things that we can achieve that will help us ease up the burden on our health systems, help us ensure that we have resilient and sustainable health systems in country by getting malaria elimination right. And how can the private sector help in that regard? Well, first and foremost, everybody talks about the private sector in terms of resources. And as we've heard from other panelists, and Dr. Kamwi referenced it as well, is that domestic resources become of utmost importance in the fight against malaria, ensuring that we have enough resource availability that as the cases get closer to zero, we still have continued investment. As a priority and burden of disease decrease, we keep our foot on the accelerator until we get to zero. And that does not mean having less resource available. It means having more to ensure that we get rid of this disease once and for all. And as you've heard from our speakers, we are all here because we believe that we can get to zero malaria in our lifetime. So the resources that we would look to from the private sector is not just cash, as people would imagine, but I think the private sector has an important role to play in advocacy, in social behavior, in workplace communications that ensure our communities understand the importance of them owning the journey to zero malaria. That without local community ownership, we will not get across the line. We also know that there's a wide private sector implementation and access opportunity. And we should be looking to how we utilize those opportunities within the private sector to their maximum. The common story always told is how you can have a cold Coke at any part of the country, but it goes way deeper and is more important than that. We know that access has been a huge problem during the pandemic, not just for malaria, but also the tools needed to fight the pandemic. So private sector can play an important role together with government in investing in domestic manufacture and ensuring that we have health systems that are resilient and that may not only work for malaria, but work across all diseases. And as we've seen, investment in diagnostics of malaria cover more than just the disease we're looking to eliminate. We know that local ownership of the disease is important, and the private sector would play a big role in that, ensuring that we know how to sell our products into the local markets. Why can't we use those same platforms to inspire our youth to take up the challenge of getting to zero malaria? Innovation and new technologies is a continued investment from the private sector. And as Professor Karen Barnes alluded to, you've got both drug and insecticide resistance. And these new innovations and technologies are needed to ensure that they don't hinder getting to zero. The private sector sometimes are hesitant to make those investments, saying the investment case or return on investment is not there for continued investment. But I believe that the conversation has changed with the onset of the pandemic, and that the private sector has realized why those investments are so important. And we should utilize this opportunity to make the most of that. We've seen that daily data, and our minister has been so good to tweet every day where we stand with COVID-19, but why can't we get that same information for malaria? And I think the private sector could play an important role there. But most importantly, it's what was said earlier, we can't leave anybody behind. And I think that the platform and the public-private partnerships that exist and can be formed will be a true test of how we get to zero in the time frame we have planned. The private sector loves a challenge. It understands deadlines and budgets. And I think that we can be a great partner to the Ministry of Health in getting us over the line. As Goodbye Malaria, we've certainly seen it in our own sphere. Being part of the E8, being part of a regional implementation of IRS and malaria elimination programs, we know that it is possible. We've seen the impact and we've seen the progress that has been made even during COVID. We would love to challenge other private sector companies to get on board and join us in this fight. And we know that this is a trophy that we can all achieve. So from my side, please let us, for this World Malaria Day, celebrate zero malaria, achievable in our lifetime, and know that zero malaria starts with me. Thank you, Patrick.
Thank you very much, Mr. Sherwin Charles, for that inspiring words, and also for the intuition and the innovation that you bring to the table to supporting our efforts to moving the malaria elimination agenda in South Africa and in the region. I think some of the challenges that Professor Barnes has alluded to, I think you very formidably managed to address those, but I think as we partner together and work together, we can make sure that we can realize this goal of getting to zero malaria in our country and in the region. It now brings us to an important part in the agenda, where we have our very own Minister for Health, Minister Dr. Zwelini Mkhize, who will give us some of his the keynote speech and the key points that Minister was very carefully listening to. Minister, the floor is yours.
Thank you very much, Dr. Patrick Munasa, who is the moderator of the session. And thank you very much to you for so ably steering this program up to this point. My brother, the ambassador for the E8 initiative, Dr. Nchabi Kamwi, and thank you very much for your input. My brother, Dr. Owen Kalua, WHO representative in South Africa, and my sister, Professor Karen Barnes, Chairperson of the South African Malaria Elimination Committee, and of course, my friend and brother and colleague, Sherwin Charles, who's the co-founder and the CEO of the Goodbye Malaria, and all our guests and members of the department, particularly the team that's dealing with the fighting of malaria, and my sister, who is going to be represented through a video later on, the former Minister for Health in Botswana, who is Dr. Joy Pumapi, who is also the Secretary for the African Leadership Malaria Alliance, whose strong support and motivation I've always appreciated throughout the time I've been in office. Thank you very much to all of you for this very special occasion. It is indeed an honor for me to address you on this event, and thank you for the opportunity to say a few words on malaria. And I want to congratulate Goodbye Malaria for organizing this meeting and for the efforts in keeping malaria high on the agenda, despite the impact of COVID in all health priorities. Malaria is a disease that that's very close to my heart. I've been working with malaria teams since 1990s when I was the MEC of Health in KwaZulu-Natal in South Africa. I fully understand the challenges associated with the management of the disease, both clinically and epidemiologically. However, over time, I've come to realize that it is indeed possible to eliminate malaria. During that particular time where one had to deal with malaria, it was quite clear that we could actually register a huge amount of reduction in malaria that had flared up as a result of the floods in that part of the country. And this was also recognized by WHO. So the experience from that is that if you are focused, you can actually deal with malaria and eliminate it so significantly that you can actually reduce even the transmission across the borders. It is encouraging to note that the Lubombo Special Initiative, the LSDI between South Africa, Mozambique, and Eswatini, has been resuscitated and renewed into LSDI-2 with the support of Goodbye Malaria as a private sector partner. And this was actually inspired by the need to boost the tourism industry between the three countries. And therefore, whenever we deal with the issue of malaria, we need to understand that it goes beyond just the issue of reducing a problem of ill health. It's also about investing in the regeneration of the economy of the particular region. Following the LSDI-1, which achieved an almost 90% case reduction in KwaZulu-Natal and Eswatini, and 60% in Maputo province of Mozambique, LSDI-2 has built on the successes with an expanded indoor residual spraying in Maputo, Gaza, and Inyambane through the Mosaswa initiative. This is Mozambique, Eswatini, and South Africa. In order for us to continue to reap the benefits of this intervention, sustainability must be ensured. In 2019, the World Health Organization estimated 229 million malaria cases occurred worldwide with 409,000 deaths. Although the WHO noted that there has been a considerable decline in morbidity and mortality since the year 2000, the current figures are still very concerning, especially when one considers that approximately 94% of malaria cases occur in the African continent. Despite several African countries reporting high burden of malaria, there are several targeting malaria elimination by 2030, and this was agreed upon at the African Union meeting by various heads of states, as well as the SADC ministers of health. Subsequently, the Elimination 8 initiative was established, which set out to prioritize elimination in the 4 low-burden countries in Southern Africa, namely South Africa, Namibia, Botswana, and Eswatini. In South Africa, I think that was well demonstrated by E8 Ambassador Dr. Kamwi, when he showed how we've actually shifted the burden of malaria and shown the areas which have got low burden but have got a responsibility for elimination. In South Africa, it is gratifying to note that the number of malaria cases decreased by 88% from 64,622 cases in 2000 to 8,126 cases in 2020. In addition, malaria death has also decreased by 92% from 459 in 2000 to 38 deaths in 2020. We have therefore prioritized the elimination of malaria by 2023 in our strategic plan, which was launched on 30th of July 2019. As a testimony to our commitment to implementing the National Elimination Strategic Plan, starting in 2019-2020 financial year, we mobilized an additional 319 million from our treasury to support interventions in 3 malaria-affected provinces over the 3 years. This additional financial assistance will strengthen our malaria program on the ground where it matters most. Program Director, while as government, we will make every effort to ensure the full implementation of the strategic plan. Let me take the opportunity to emphasize the need for us to work with all partners towards attaining malaria elimination in South Africa, in the SADC region, and in the African continent. Public-private partnership has been a bedrock of our strategic elimination goals, and we are thankful for the great effort that have been achieved thus far in the partnership that have been forged with partners such as Goodbye Malaria in business and private sector. It will be remiss of me not to say a few words on the neglected tropical diseases, what we call NTDs, and the initiative we're embarking on to address both malaria and neglected tropical diseases. Despite significant progress, malaria and other neglected tropical diseases remain a threat to the health of our people, especially the most vulnerable, and also exert a broader economic and social impact. According to the United Nations, South Africa ranks 39th out of 49 countries in Africa that are endemic for at least one neglected tropical disease. Nearly 16 million South African children need treatment for intestinal worms, but only 2.25 million, which is 14%, receive the necessary treatment. Likewise, 2.6 million children need to receive treatment for bilharzia. Without ensuring that we close the gaps in the malaria and NTD's national strategy, these preventable diseases will continue to threaten South Africans, increase work absenteeism, and burden health facilities that face other challenges such as COVID-19, TB, and HIV. And not to mention that these diseases tend to actually complicate into other aspects of life. For the worms, stunting, malnutrition, as well as issues of anemia can arise. Similarly with bilharziasis, issues of malaria and urinary tract infection, particularly complicated bladder diseases can also arise from that. To address this issue, the South African National Department of Health, under the direction of the Director General, Dr. Buthelezi, and Goodbye Malaria have agreed to establish an Malaria and Ntd Fund. This public-private community partnership will mobilize financial and in-kind resources, invest in advocacy and implement interventions to end malaria and NTDs in South Africa. The fund will be an independent organization as governed by the board of directors, composed of senior leaders drawn from government, the private sector, and civil society. The sectors will work collaboratively to support the National Malaria and Ntd program to end these diseases in South Africa. The details of the fund will be shared with you in due course. Program Director, let me also, as I move towards the end, say that the elimination of malaria, albeit a difficult task, is within our reach and will persistently pursue this goal until we achieve it. I want to actually acknowledge all the input that has come from all the speakers, starting with Dr. Kalua, who has given us a whole analysis of the impact of malaria in the whole of the continent, which is a very important issue from the point of view of the focus of the African Union. The fact that we have to make sure that we reduce malaria mortality, reduce the number of cases, and ensure that we actually reduce transmission of malaria from within the countries and across the countries. It's actually quite important for us to note that the reports that has been shown together with the trajectory that it has displayed is actually indicating that we need to actually increase our effort in dealing with malaria so that we can reach the targets. And of course, this is something that we need to really take a special focus on so that we can change the trajectory from what we have seen. An important point raised by Dr. Kamwi is that of cross-border collaboration, which is key. Because malaria, the parasites, the mosquitoes, don't use passports and they move across boundaries. Wherever our people move, the malaria will, mosquitoes and malaria will move with them. And therefore, it's important for us to make sure that the elimination happens on both sides of the border, and coordination at that level is important. Advocacy and sustainability and ensuring harmonization and synchronization and optimal management of all of these programs is important. All of this has to take into account the need for additional resources as well as the empowerment of community. I want to thank you, my brother, for the passion with which you have always led this issue of fighting malaria. And Professor Barnes, and I also want to appreciate your leadership in this regard, all the analysis you have given to us about what we need to focus on, particularly the issues of insecticide resistance and also the challenges of artemisinin and the need for us to start promoting the use of primaquine, including the possibility of having to encourage investment in the manufacturing thereof. The issues of connectivity and to improve our surveillance, I think you have actually made it very clear of simple things that can actually make the program even more effective. Then, of course, Sherwin the most exciting thing about this is how the private sector got drawn to understanding the importance of fighting this, malaria together with government. I think the point of having to focus on what the strength of the private sector that it can bring into this whole issue, looking also at encouraging the private sector investment in improving our own capabilities. You know, every time we sit here, we have to look at having to go to India to buy DDT, and the issue is, you know, what is the possibility of actually bringing some of those industries to be in the continent, because we're the main consumers of this particular product. And of course, it's important for us to start looking at investing in production of diagnostics and other pharmaceutical products for treatment. And in addition, we need to also increase our research and development so that we can find easier and better solutions for the continent of Africa, where the major burden of malaria is. So the question of alignment of the industrial policy and support for investment becomes very, very important in this case. But I think what is key to all of us is to see the need for us to bring together government, private sector, communities in a lasting partnership that ensures that we leave no one behind. And I agree, attaining zero malaria is attainable, and it is attainable within our lifetime. Let's work hard to make sure that we can reach the targets that we have set for ourselves and change the trajectory of the elimination of malaria and improve the livelihood of the people of this continent, in particular improving their health status, as well as also improving the economy by ensuring that malaria is completely eliminated. Thank you very much. I congratulate you for hosting this very, very important session. Thank you very much.
Thank you very much, Minister Mkhize, for those very inspiring words. Also, we're showing that former Minister Kamwi, that South Africa is putting its money where its mouth is. You've heard, Minister, in terms of the domestic resource mobilization. So thank you very much, Minister, for all of your kind words. If we can just bear on for a little bit longer, we would now try and get a short video from the African Leaders Malaria Alliance, Ms. Joy Pumape. She's the current Executive Director for the African Leaders Malaria Alliance. If we can get the video to play now. Thank you very much.
Honourable Minister of Health, Dr. Zwelini Mkhize, Professor Karen Barnes, Chairperson of the Malaria Elimination Committee, Dr. Owen Kalua, WHO Representative, Dr. Nchabi Kamwi, E8 Ambassador, Sherwin Charles, co-founder and CEO of Goodbye Malaria, the DG and ministry officials, distinguished ladies and gentlemen. Greetings from the African Leaders Malaria Alliance. Early last year, our chair, His Excellency President Uhuru Kenyatta, called on African leaders to join him in establishing 15 national and malaria councils and funds. It is my great honor to congratulate the government of South Africa and Goodbye Malaria for the announcement of the creation of the Malaria and Ntd Fund. This public-private community partnership is a monumental step towards malaria and NTD elimination in South Africa. This weekend, as we commemorate World Malaria Day, we recognize the significant progress that Africa has made in the fight against malaria, even though we still have 215 million cases and 384,000 deaths in 2019. We take time to remember those that we have lost, many of whom were small children under the age of 5 years. And we renew our commitment to eliminating this disease once and for all. Progress made since 2000 has resulted in more than 1.2 billion cases of malaria being avoided globally, and more than 7 million lives saved across the African continent. This is a case and a cause for celebration, especially for South Africa, which aims to eliminate malaria as one of SADC's elimination aid countries. This fund addresses two important critical challenges to health and development: malaria, which infected 13,833 South Africans in 2019 and killed 79, as well as neglected tropical diseases of soil-transmitted helminths and schistosomiasis, which threaten school children and require the administration of up to 7 million preventative treatments annually. If left untreated, these parasitic diseases can result in organ damage, malnutrition, and death, while, like malaria, also contributing to lower academic achievement for our children. Defeating malaria and NTDs requires partnerships and concerted effort. I commend South Africa for keeping these debilitating diseases high on the national and subnational agendas. This is particularly important during this demanding COVID-19 pandemic. The message that this launch is sending out is loud and clear. Malaria and NTDs are not on vacation during this global pandemic, and South Africa will remain vigilant. South Africa can eliminate malaria and NTDs. The indoor residual spraying, sleeping under mosquito net each night, seeking testing and treatment immediately for a fever, chills, headache, or nausea, all must become second nature for our communities. For NTDs, it is taking the preventative treatment, washing hands, practicing good hygiene, drinking boiled or filtered water, seeking treatment for headaches, rash, abdominal pains, or diarrhea. To defeat malaria and NTDs, South Africa is holding its stakeholders, each and everyone, accountable for doing their part. I am confident that this new fund will enable the private sector and government to work together to ensure that the resources required are available to defeat malaria and NTDs. Stakeholders will work together and across all sectors to mobilize funding and in-kind support and services to ensure that the country achieves its national targets. I look forward to seeing the commitments and contributions the senior leaders drawn from across all sectors will be able to mobilize and advocate, take action, and contribute resources and use the scorecard and action tracker for monitoring, reviewing, and holding one another accountable. Congratulations, Honourable Minister. Congratulations to the Malaria Elimination Committee. Congratulations to Goodbye Malaria, to the private sector, to all the sectors, to the communities, to the E8. You are one step closer to a malaria-free South Africa, and I applaud you. Together, today, on World Malaria Day, you are drawing the line. Zero malaria and NTDs starts with me and with each of you. A malaria and NTD-free South Africa starts with all of us, and ALMA is privileged to be working with you. I thank you.
So a big thank you to Joy Pumape from African Leaders Malaria Alliance for her message and her support for supporting the malaria elimination efforts in South Africa, but also a challenge to us as the ministry and also to our partners and to Goodbye Malaria in terms of how we take this up and accelerate towards malaria elimination, bringing all the partners together in our fight. I'm going to quickly now move to some of the questions that have been put in the question and answers box, and I'm just going to read them out, and I'll allocate some of them to some of the panelists very quickly. The first question that we have, and maybe this question I can ask Dr. Kamwi, what is the biggest contributor to the problem of malaria? The next question, maybe if I can ask this question for Dr. Kalua to respond. Why is the African continent still battling with malaria? And then Professor Barnes, if I could ask you this question, has COVID-19 delayed anti-malaria efforts? And then again to you, Dr. Barnes, Professor Barnes, if I contract malaria and I suspect I may have COVID-2, which should I test for and treat first? The other question there is, again, maybe Professor Barnes, if you don't mind taking this quickly, what are the common symptoms of malaria? And then the next question is, how can people at risk of getting malaria identify the differences between COVID-19 and malaria symptoms? Dr. Barnes, I see you have many questions for you, so maybe if you can also pick that one up quickly. And then maybe the other question that we could ask is to Sherwin, what can local South Africans do to help eliminate malaria? I think those are the questions, and let's get responses to that for now, and then we'll come back with some other questions for some of the other panel members. Thank you. Over to you. Those questions will be posted. We start off with Dr. Kamwi. Okay, maybe we'll take from Dr. Kalua. Why is the African continent still battling with malaria?
Thank you very much, moderator. I think first of all, let me say that I also am very optimistic that working together, we can get to zero. Now, specific on the question that is raised, to begin with, most of the African countries already started with a high burden of malaria, particularly with the conditions that are conducive for the vector that transmits the disease. And of course, as I showed in some of my slides, a lot of progress has been made and good work has been done by many governments to try to address malaria in their various countries. But the challenges do continue. And one of the key issues is that to deal with malaria properly, we need to have strong and resilient health systems that are able to respond and address the issues of malaria. And to be able to have these interventions scaled up adequately and reach all the people that need to be reached with these interventions so that we can address the problem of malaria. So the question of leaving no one behind is important. We need to be looking towards the issue of universal healthcare for malaria, to be able to access, for people to access the intervention that they need. The interventions we know, and we know the ones that work, but one of the biggest challenge is the fact that they need to be scaled up. And part of that is that we need adequate resources. And I showed in one of my slides about the funding. Still at the moment, the national governments of endemic countries are contributing something like a third of the total funding that has gone into malaria. So it's important that this is scaled up as well, so that domestic resources are brought to bear, and at the same time that these resources are used quite effectively and efficiently. So those are some of the things that we start with a high burden. We know the interventions, but these interventions have to scale up, and we need to build the systems that are required. And of course, we need to have strong partnerships and also be able to work closely with communities to reach even the unreachable, even those vulnerable population, hard to reach populations, so that everybody has access to these services. And that's not easy in the context of the Africa region. The challenges are many, the requirements are many for resources, and those are some of what continues to affect us. But the good news is, as has been presented for South Africa, it's very clear that this is achievable. And many countries have moved also towards attaining elimination. And those number of countries are increasing every time. So we are quite, despite the challenges which are there, we're quite confident, optimistic that we can get to zero, and we should put our focus and work together towards that. Thank you, Mr. Moderator.
Thank you very much, Dr. Kalua. Go to Professor Barnes.
Thank you, Dr. Manasan. I think in the time we have available, you've given me quite a big challenge to answer all of your questions quickly. I think that the key things to be aware of, firstly, malaria symptoms. So fever, flu-like symptoms, chills, body aches and pains, very non-specific, are the early signs of malaria. And that's when we want people to seek treatment, because malaria can rapidly progress to things like cerebral malaria, respiratory distress, difficulty breathing, jaundice, kidney failure, and many other complications. Obviously, there's a big overlap between those symptoms and the symptoms we all know so well from COVID. So the questions regarding what to test for first, do both immediately. A malaria test result can be obtained as quick as 15 or 20 minutes. If it's positive, malaria treatment can be started. That doesn't mean that the COVID test should not be done. You'd also do a COVID test. If you also happen to be COVID positive, then obviously you need to be treated for that. A very good question around the impact of COVID on malaria efforts. So there are numerous impacts. To give some examples, indoor residual spraying, as I said, is the backbone of how we control malaria in South Africa, where we're lucky enough that most of our mosquitoes bite people indoors. Indoor residual spraying has been particularly challenging in the last year because people are scared of COVID, they're scared of other people coming into their homes, and obviously the spray operators need to be well protected in terms of not getting COVID. There's also been, unfortunately, a fear among some people about seeking treatment. They kind of imagine that clinics and hospitals are sources of COVID, and so they don't want to go there quickly when they have potential malaria symptoms. And so we need to work together with the media, and I'm really pleased to see some of you on the call, to encourage people to seek treatment, because if we treat people quickly, we make them better before they get severe malaria, before they're able to die from malaria, but that also can reduce onward malaria transmission. I hope I've covered the key components of your many questions, Dr. Monasa.
Thank you very much. It was perfectly done, Professor Barnes. Sherwin Charles, there's another question also to add to the question I asked you, is how and why did the private sector get involved in the fight against malaria? Over to you, Sherwin.
Thanks very much, Patrick. So the first question that was posed is, what can South Africans do? I think the most important starting point is to believe that we can get to zero. We need to inspire and empower the younger generations, our youth, to be the change agents in our communities. You know, the one thing COVID has taught us is that we have to adhere to the protocols. And the same applies for malaria. We know where we have hotspots in South Africa. If you live in those hotspots, ensure that you have access to protection. You ensure that you seek timeliest treatment. If we're visiting from other areas to those hotspots, ensure that we do take prophylaxis, or we do have insect repellents. We know when those nasty mosquitoes are most likely to bite, ensuring that we do have long sleeves that dust. These are the simple protocols that we can take to prevent us getting malaria. And of course, as Professor Barnes said, and as all us private sector have now become scientists, we can break the transmission. So let us follow those protocols. It is important, and I think that when our communities take ownership of getting to zero, we certainly will get there. And why and how did the private sector get involved? I think we were inspired by Robbie Brosen and the co-founder of Nando's, really to ensure that when we put our heart into something, we have the right impact. And that impact is measurable. And as the private sector, there's a lot of power in our hands to work with government to get us over the line. And we saw malaria as being a devastating disease on our continent, particularly to children under the age of 5 and pregnant mums. And we saw how this disease keeps people in poverty. And so for us, it was an easy decision to make that would not just impact eliminating a disease, and we have all the tools to do that, but also change the GDP within our communities to improve children's education and learning opportunities. By taking out malaria, we make a huge difference to our goals and ambitions within the Sustainable Development Goals that we've set ourselves for 2030. So I think that it was, for us, an easy decision. We have lots of extra hot peri-peri, so the passion goes with what we do. And it was an easy win, Patrick.
So thank you very much, Sherwin. Participants and those who have asked some questions which haven't been answered, I'm afraid we've run out of time. But what we can do is we can ask some of the panelists to maybe respond to them, and we can send you these responses via mail. The team that's here, the excellent team that's working on this, will ensure that we do that. So for those of you on this call, I think Minister, excuse me, Minister Mkhize has summarized it very well. All that's left for me to say is a big thank you to the panelists, Professor Barnes, Dr. Richard Kamwi, Dr. Kalua, Minister for Health, Sherwin Charles, and also to Joy Pumape. Together, we can be stronger in this fight against malaria in South Africa. And together, we can achieve zero malaria, and we can draw the line against malaria. Thank you very much, everyone, for your participation and for your patience. With that, we bring this roundtable now to a close. Thank you, and over and out.
Why is not the recording?